there's a significant change, and that's that when you are a health plan applying to expand or enter a new market, you're going to be required to demonstrate that you are going to meet network adequacy in the provider network that you're putting forward for consideration. How do you demonstrate that you are going to have a compliant provider network? Well, CMS is offering some tools designed to help meet that adequacy requirement. And we're going to look at a couple of those right here. The first is the idea of a 10% credit. So as you go through the process and you submit your application, there's a 10% credit that will be offered to a health plan who's looking for expansion, permission to expand, for the time that it takes to move through the certification and application process. Now, at the end of the application process, when the plan goes live, that 10% credit goes away, and the expectation is, the requirement is, you will be fully compliant with all network adequacy requirements upon going live. Another way that CMS is offering in the rule to meet the adequacy requirements is through the use of letters of intent, or often in the industry we throw around LOIs. And this would allow an applicant who's seeking to expand into a new market to present letters of intent. So short of a formal contract with a provider, to reach that threshold for certification and to receive all permissions to expand into the new market, you can use the letter of intent. But there's a couple of things to keep in mind. One is that at the beginning of the new contract year, you would need to have those letters of intent moved to full contracts in order to count toward meeting the network adequacy requirements for Medicare Advantage. Another thing to keep in mind is that the use of the letter of intent will signal that you're going to participate as a health plan in the Triennial review by CMS, and that participation would be in the first year the plan is operational in the new service area. So if you use the letter of intent to demonstrate that your provider network will meet the network adequacy requirements, even when you move the letter of intent to a full contract as required through the regulation, you should expect to participate in a triennial review to confirm that your network adequacy with contracted providers meets the requirements in the first year that your plan is operational. So the letters of intent are a tool that is available. It's part of demonstrating through the application process that your provider network will meet adequacy. We should just use that tool, understanding that the letters of intent need to become full contracts when the plan is operational, and that there is likely to be a triennial review in the first year of operation, triggered by the submission of the letters of intent.